Hello friends, this is Dr. Pankaj Maheshwari from Fortis Hospital, Mulund. I would like to share my experience about approach to urinary tract infections with you today. You would agree with me that urinary tract infections is an extremely common problem. It is one of the commonest presentation that a treating physician sees in his day-to-day practice. Now, how do we define infection or urinary tract infection? The words used to define urinary tract infection are dependent on where exactly is this infection. So if the infection is localized to the bladder, we will call it cystitis. Once it goes higher up to the kidney, then it will be called pyelonephritis. The terms acute or chronic would be placed based on how long is the duration of presentation of this patient. Further, infections could be spontaneous or they may happen in the hospital, which are called as nosocomial infections. We would also classify these infections into uncomplicated and complicated. I would come to that in my next slide. Like a lady presenting with a single episode of infection would be called as an isolated infection. But if she doesn't complete her treatment and recurs with the same bacteria, it would be an unresolved infection or a reinfection. Or if she has developed multiple infections in a period of 6 months, then this would be called as a recurrent infection. Most commonly, recurrent infection should have different pathogen. Relapse of infection or residual infection would have the same pathogen. Complicated infection would be when there is some other predisposing factors associated with infection. Like say a patient coming with neurogenic bladder and infection would become a complicated infection. Every man, if he has infection, even a single episode of infection is considered as complicated. Now in women, because the urethra is short, because the genital tract and the urinary tract are very nearby, that is why the risk of infection in women who are sexually active is high. But in men, such type of infection usually do not happen. Even in women, if infection is associated with active pregnancy, this needs to be taken seriously because during pregnancy, infection carries a risk both to the mother as well as the developing fetus. Elderly patient, diabetic, immunosuppressed patients can deteriorate very rapidly due to infection, and hence they need to be treated with caution and with aggression. Hospital-acquired infection in patients with stents or indwelling catheters are difficult to treat, usually have resistant bacteria, and hence are considered as complicated infection. And any infection which doesn't respond to your regular treatment within 7 days, consider it to be complicated and investigate it accordingly. As we know, the commonest pathogen is E. coli, but we commonly see Proteus, Klebsiella, Enterobacter. Chlamydia, Staphylococcus are rare. Candida infections would happen in patients who are immunocompromised. In our Indian situations, we should always keep our eyes open to look for tuberculosis. When a patient presents with infection and you suspect it to be a complicated infection, look for whether there are any factors which is increasing this infection. The common factors could be obstruction. Obstruction could be urethral obstruction starting from phimosis to stricture to prostate to bladder neck obstruction. It could be some stones either in the bladder or in the urinary system that are blocking, or it could be congenital PU junction obstruction, vesicular reflux, which all serve as a hindrance to the normal passage of urine and hence would predispose a patient to infection. Patients with uncontrolled diabetes may present to you with renal papillary necrosis, and these papilla, which are a part of the normal kidney, they fall up from the kidney, block the pelvic ileal system, and then serve as obstruction to the urinary system proper. Treating these becomes difficult because not only there is obstruction, but also your patient has associated uncontrolled diabetes, which may make treatment a bit difficult. Spinal cord injuries are associated with neurogenic bladder, and hence treatment may be difficult, and treatment will need to be planned based on what type of neurogenic bladder patient has, whether it's a lower motor neuron bladder or upper motor neuron bladder. Now, in infancy and young children, infections are more common in men because men, younger children would present with have say posterior urethral valve, may have pelvic aortic junction obstruction. So infections are more common in boys in infancy, but in the preschool age group, in the adult life, infections are very rampant in women. Rather, they become extremely rare in men, and after the age of 60, again infection starts happening in men because of prostatic obstruction. So that is why any man or adult coming with urinary infection in a man, this needs to be taken seriously because this could be a result of some complication or some obstruction. There are a lot of risk factors which would predispose a lady to infection, and the commonest risk factor or the commonest cause for infection in a young lady is sexual activity. During sexual activity, sadly what has happened is, due to our cultural habits, girls grow up thinking that sexual activity is something bad, something dirty, and so even after their marriage, and when the sexual activity or sexual life really starts, this activity, they try to clean themselves excessively after every sexual act. Understand that the act of cleaning increases the risk of infection. Our body has systems by which whatever, say, infection may happen during sexual act gets cleared on its own. So excessive cleaning, may be by tissues or by water spurts, would increase this risk of infection and not reduce it. So what a lady needs to do is definitely pass urine before a sexual activity, try and pass urine after sexual activity, and change her undergarments. That is all that is needed. No other special cleaning or any precautions are needed. Using spermicidal jellies or those impregnated condoms would increase the risk of infection. Postmenopausal, because of the hormonal changes, there is atrophic vaginitis, there is urethral stenosis, making them more prone to infection. There are many unproven factors associated with UTI, but one of the most important thing that I would want to say here is there is a fashion to use some chemicals in the vaginal area, using some sprays in the vaginal area or cleaning solutions. All these things would increase the risk of infection, and hence these should be strictly dissuaded. Bubble baths, chronic diseases, obesity, they all make a person more prone to infections. So how would I approach if a patient comes to me with UTI? First important thing I need to understand is the patient symptomatic or not? So if a patient comes to you with a culture report showing infection, but he's absolutely asymptomatic or she is absolutely asymptomatic, probably you just need to observe this lady. You would treat her only if she is pregnant or if she is diabetic. If there are symptoms, then I would classify whether it's a complicated UTI or a simple UTI. If it's a simple UTI, I would try to see whether it's a first episode or a recurrent episode. A solitary episode of UTI in a young lady may not even need antibiotics. Just give her anti-inflammatory drugs, painkillers, maybe some urinary alkalizers, and wait. Antibiotics only if there is fever. But recurrent UTI would need evaluation, may need treatment with antibiotics. And if it's a complicated UTI, the treatment will be based on what is the complication that has led to infection. And this would probably need aggressive treatment. Thank you.